Good morning on this Wednesday. Appreciate you joining us for our third installment of Your Mental Health Connection. I'm Brendan Kinney with UpNorthLive News, and we are joined by two new friends. Erica, we've already met in the past here with Northern Lakes Community Mental Health. Thanks for joining us this morning.
Thanks for having us.
And we'll start with Erica. So she's a pro at these segments here by now. Erica, if you can explain who you are, what you do, and then we'll get to Abby and Melissa with the introductions.
So my name is Erica Salmonson, and I work at Northern Lakes CMH as a Child and Family Operations Manager. And I'm in the Traverse City office. And I've been doing this work in this community for about 26 years. So it's been a while.
And Abby, we'll go up to you. Good morning to you.
Good morning. So my name is Abby Schoenfeld, and I do the same role as Erica, but I'm out of the Cadillac office. And I'm relatively new to the area. I've been doing this position for the last year.
All right. Good morning, Abby. And hi, Melissa.
Good morning. How are you?
Doing well. Thank you. What should people know about you?
So my name is Melissa Trout, and I also am a Child and Family Operations Manager. I'm in the Roscommon and Crawford counties. And I've been doing work for 21 years. So I've been with the agency actually going on 21 years. So lots of different roles, but been in the management role for over 10 years.
All right. Thanks for those introductions. And if anybody's just tuning in for the first time, they're like, what is it? What's going on? What's Northern Lakes Community Mental Health? Anybody can answer this. What kind of work do you do? And how can people get a hold of you if they need to?
I expected you to jump in, Melissa.
Go
ahead.
So we provide services to children with serious emotional disturbance, so mental health challenges. And we provide services from 0 through up to 21 in the Children's Services Department. And we provide a range of services: outpatient therapy, home-based therapy, case management services, wraparound. We have psychiatry. We have some great youth peers and parent support peers. And so we do a range of things, but we definitely try to provide as many services as we can in all of our counties.
All right. And you cover quite a large area. Now, we're based in Northern Michigan. If you can explain kind of how wide your coverage area is.
Sure. We cover Roscommon, Crawford, Wexford, Missaukee, Grand Traverse, and Leland, all counties.
All right. Well, thanks for that introduction. Do you think that covers everything for now? Do you want to get into our topic for today?
That would be great.
That works for everybody. Good deal. So we're talking about children's mental health issues here on this Wednesday here in March. And since you are all the experts in this field, where do you want to start with this? What are kind of the foundation piece of information we want to start with?
I think we would like to start with like what parents can do if they're seeing symptoms that they're a little bit worried about, and where they would start with their own kids.
Mm-hmm. Yeah, it's a great place to start, Erica.
So I'm a firm believer that parents are a big key to their kids' mental health. And we just need to be paying attention and leaning in and asking the questions. We don't always need to necessarily jump to, oh my gosh, my kid needs therapy. They may need therapy. They may need extra support. Your family might need extra support. But I think parents kind of taking a breath and leaning in and talking with their kids about what they're seeing and what they're worried about. And maybe coming in with validation to the things that the teens are saying or the adolescents are saying. Kids' lives are kind of stressful these days, and especially if they've got phones and tablets and access to internet, they're seeing a whole lot more. So I think starting with parents feeling like they are the expert of their kiddo and their family. And when they see something going on, just leaning in and talking to the kiddo about what's going on. I'm seeing these kind of things, and I'm feeling a little worried.
Mm-hmm. And what is the difference between normal teenage behavior and when should parents maybe start to worry, Erica?
So I would say typical is, and let's just talk about teens. Increased moodiness is pretty normal. Intense, long-lasting moods, risky mood behavior, major depression, kind of panicky stuff, that would not be typical. Increased feeling self-conscious could be pretty typical, but social phobia or withdrawal would not be maybe typical. That might be something of more concern. Increased parent-child conflict, especially in adolescence. This is a time when kids are figuring out who they are. That's pretty normal, and it's something that you can kind of chat about. Verbal, physical aggression, running away, that's probably beyond normal. A lot of kids are transitioning into middle school, into high school, which are really big transitional times, a lot going on, a lot of social stuff going on. So it's normal to be nervous about that kind of stuff. But school refusal, bullying, being bullied, that's when you probably need to either reach out to school or reach out to a professional. I think argumentativeness is probably increasing during adolescence, but I wouldn't say that rebellious questions and getting rebellious outside of what normally would be your personality of your kiddo towards family members, teachers, people of authority, that would probably be stepping out of normal. So just kind of taking a look. And sometimes I always found it helpful to talk to my parent friends when my kids were going through something, to kind of see, is this something that, a normal 13-year-old might be going through? And that was really helpful. And if it really felt out of bounds, then I would start talking with other adults in the kid's life and maybe teachers and see if they've noticed differences and kind of take it from there.
Great examples of the fact that it takes a community to raise a child. Yeah, bringing other people in and kind of getting their take on things. If anybody has anything to add to that, go for it. I was going to go to Abby for our next topic. Did anybody want to add anything to that topic?
I think Erica did a great job covering that.
Good deal. So Abby, on to you. And obviously we've all been teenagers at one point. And I'm curious to know, what are some of the challenges you're seeing now with today's teens that maybe we didn't have to deal with when we were teenagers?
Yeah, so definitely technology. I know everybody is kind of learning as we go with that one, but with social media, access to tablets, to phones, that like constant connection to peers, family, people across the world, that's a huge change for kids and teens these days. And with that cyberbullying, bullying isn't anything new, but the fact that somebody could potentially just be experiencing all hours of the day, or it could be really reaching a wide audience, that's a huge change for kids today. And I think with that too, like just the increased anxiety from the pandemic, all of the changes with that, with virtual schooling, with climate change, with hearing about that more, with hearing about mass shootings and gun violence, all of these things are changes now that kids these days are experiencing that we didn't necessarily experience as much when we were younger.
And how can parents help kind of guide their children through the process of adapting to all these changes?
Yeah, definitely. So I think the biggest thing is limiting screen time, limiting access to how frequently kids are engaging in these types of media. But at the same time, being curious and talking with your kids about who they're talking with online, what they're looking at online. There's lots of different apps and things out there that can kind of track like your child's safety when you're online. So things that will monitor for bullying, for potential abuse, situations that we really don't want our kids to be in before they happen. I think modeling appropriate ways of handling disagreements with other people. So definitely around some of these hot topics with the pandemic, with climate change, with gun control, gun violence, things like that. Just kind of showing your kids that there's ways to talk about these things and be respectful to other people's positions, but still having that empathy. And again, really modeling good social skills with other people around these kind of hot topic issues. But along with that, definitely keeping it developmentally appropriate when you're talking about the topic. So not, bending the truth or hiding things, but keeping it straightforward and direct, but keeping it in a way that is appropriate for an 8-year-old or is appropriate for a teen, whatever that might be.
Mm-hmm. Great pieces of information, Abby. Before we go on to Melissa, anything anybody wants to add on that?
I don't think so. I think she really hit on a lot of the issues that we see walk into our office and parents talk to us about.
Mm-hmm. And Erica, going off that topic here for Melissa, I'm curious if parents watching, they've noticed some changes in their child, they do want to explore that therapy option. How do they go about doing that?
So first, I think, and Erica had touched on this a little bit, but I think first talking to your child about going to see a therapist, assuring them that it's for support and help, not because they're in trouble. Talking about the common issues, some of the things that Erica brought up, some of the things that Abby brought up, and explain what a therapist is to provide help and support. As a parent, it's going to be really important that they're supportive to the child in a therapy experience. In accessing therapy, anyone can contact our office and inquire about therapy services. With Northern Lakes Community Mental Health, our services are based on eligibility criteria. We serve the most severe individuals when it comes to mental health needs, but we always will provide resources to individuals if they don't meet our criteria for services. Other resources are using like your insurance, calling your insurance, finding out who providers are for behavioral health. There's resources online, like Psychology Today is always a good resource to find a therapist. So there's lots of different ways to, like, when you're thinking about getting them started in therapy, there's resources to find therapists, but you also want to be having those conversations with your kids about why do we need to go to therapy? What concerns you're having as a parent, and what are some of the concerns your child is having, like having those open conversations to find out more. Like, they're probably experiencing a lot of things similar to other kids and what they're experiencing, and maybe they're just not talking about it because they're not sure. And so having those open conversations, being honest about the things going on, and just assuring them that it's for help and support, not because of anything that they're doing wrong.
Mm-hmm. And Melissa, did you want to talk about step by step if somebody comes to you to get some help, to get some therapy, and just kind of talk through things? What should they expect step by step through that process?
Yeah. So once they meet with our access department and they do a clinical assessment to determine what all the needs are, then they determine what kinds of services. So let's talk about therapy specifically. If they decide based on the needs that therapy is a recommendation, then they would meet with a clinical therapist and they would talk about what the needs are and then start with developing a treatment plan. And what that would look like is talking about what are the specific goals for treatment? What are they looking for in terms of what do they want to change or what do they want to accomplish? Things of that nature. And that would be with the child and the parent together. We always include the parent or the caregiver because sometimes it's not the parent. It might be a grandparent or another relative that's supporting the child. So we always include them in the treatment planning process. That's really important that they're involved in that because they're the ones supporting the child outside of therapy on an everyday basis. So it's really helpful to see their role in therapy as part of the team. Like, they're part of the team in helping this child reach their goals, support them every day, utilize the skills that they're learning in therapy. But it's an ongoing discussion. We include the parents, and sometimes they might be included in every session or part of a session, or sometimes every other session. But on some level, they're always included because we need their support to support their child. They know their child best, and we're looking at them to help us in helping their child.
Mm-hmm. Thanks, Melissa, for taking the time to walk people through that process. Before we get on to the spring break topic, since we're in, Abby, Erica, Melissa, anything else you want to add?
I don't think so. I think one thing that we're noticing more in our field is the lack of parental confidence sometimes that they can handle some of the situations that are going on with their kiddo. And so that's something that I think any of our therapists that we have on staff are working with from the beginning. Is just, this is your kiddo, you know them best, you're the specialist. And sometimes parents themselves need their own support. Maybe they've been through some traumatic events or had, rough childhoods, and they're not sure where to start. So a lot of this is about supporting parents to then eventually be able to feel confident supporting their kids through the bumps of life, because every day we have things that we've got to deal with. So parents are key.
And speaking of parents, maybe if the kids have been behaving, they're going to take them, I don't know, down to Florida or something for spring break, or even stay in northern Michigan, wherever anybody's going for spring break. Maybe they're staying at home. What advice does everybody have to have a nice spring break between the parents, the teens, the children? Any pieces of advice?
I think one of the most important things is just to really spend time with your kids. Plan something fun. It doesn't have to be a trip to Florida. It doesn't have to be something huge, extravagant, but get outside, spend time in nature, thinking about sustainability and being in nature and unplugging from social media. Those are all really important things, and spring break is a great time to do it.
I was just going to say, and it's really quality, not quantity. So, no matter what you do, some people can take those trips, others are not able to afford to do that. And so, like Abby said, just doing activities that are just spending that quality time together, that can be as memorable as something significant, like a trip to Florida or something. So, whether it's walks, whether it's, going somewhere local and checking out, a place to hike or, spend time. I think those are really significant to kids and can make a difference.
I think a lot of kids are looking forward to just unwinding. They get to this point in school and they just want to chill. They're close. They're getting close to seeing the end of the year, and they're ready for spring and they just want to chill. So letting them sleep, maybe not over planning either, try and find some time to just hang out and do some of those more natural kind of things, maybe cooking together or, chilling out. And some parents are still going to be working. So it might just be like stuff you're doing after work. Maybe you're, playing cards or going to a movie or cooking dinner together. You're right, Melissa, it's about quality, not quantity.
And hiking was mentioned, and we haven't had to wear a lot of layers here in northern Michigan lately with the temperatures being so warm. So yeah, getting outside, enjoying the sunshine when we have it. Yeah, great ideas. Well, I appreciate everybody's time today. Like we'd mentioned, this is an open conversation. If there's anything else that anybody wants to talk about, now is the time. Otherwise, we will wrap things up. I'm not hearing anything. So is everybody good?
I think we're good.
We're good
for today.
All right. Well, thanks for your time. Thank you for watching, whether it be on UpNorthLive Facebook, YouTube, X. We'll be doing this again next month, which is April already. I had to think about that for a second. And I'm guessing too, if anybody needs to reach out to your organization, to Northern Lakes Community Mental Health, phone number, email address, what's the best way to get a hold of you guys?
So anybody could call our 1-800 number. So that's 1-800-492-5742. And then for those individuals that don't know, we have crisis services 24/7. And so if anybody was in crisis, and everyone defines their own crisis, then they can give us a call at 1-833-295-0616.
All right. Great information. Thanks for your time. We'll see you later.
Thank you.
Thanks, Brendan.